Welcome back, Health Impact audience. We've had a jam-packed couple of days, and we're finishing off with a very strong session on how do we pull together all of the discussions that we've had over the multiple sessions since we started talking about all this stuff yesterday. So this session is generally titled the fact that we're looking ahead. What do we see as a comprehensive digital strategy for healthcare in this new hybrid world we're thinking of? And, as event producers and as writers and speakers, we always like to label things. And one of these labels that we're putting these days is the idea that hybrid care is somehow different than the care that we've had in the past several decades. But that's not quite true, right? We've always had the idea that parts of what we do happen in ambulatory, parts of what we do happen in health systems, in acute care settings. We've had surgical centers that have been separated. So this idea of things decentralizing and then re-centralizing sometimes, but decentralizing has been around for many years. But now we're talking about a very specific kind of decentralization, and that is going all the way to the home in this, Uber hybrid healthcare model. So that's what we're going to talk about over the next 45 minutes or so. And of course, you'll have lots of time to ask questions towards the end. So be starting to queue up your questions. If you want to come online, we're going to put you on the camera. But of course, you've got the chat, and our speakers will be answering questions while they're talking on stage here. So now let's talk a little bit about this idea of true transformation. What is the idea of transformation as we saw it pre-pandemic? What is the idea of transformation as we see it post-pandemic? That's what we're going to jump into first here. So we know that transformation should not be tied to technology. It's tied to what patients are willing to do, what their caregivers are willing to do, what our staff at health systems are willing to do. So transformation occurs when staff and colleagues on the health system side, coupled with patients and providers, are willing to do something different. And that's really what we've had. Nobody says that the pandemic was a good thing or et cetera. But one silver lining that came out of this massive storm that we're going through is that it forced us to rethink technology and do in 1 year what would have taken 5 or 10 years. And I think that would, everybody's in general agreement that if anything good came out of this pandemic, it is the speed at which we know healthcare operators can operate. It's not true that healthcare is a bunch of laggards in technology. It's a bunch of folks who are, slow to adopt, et cetera. It's just that the adoption was never necessary before, but now we've seen when it's necessary, it can happen rapidly. And so that's what we're going to talk about in this session here. So we've got some great expertise from the practicing practitioner side of health systems. And so we're going to start, Stephanie, if you want to introduce yourself, then we'll go to Karen and then to Raj.
Sure. Thanks, Shahid. So I'm Stephanie Lahr. I am the CIO and CMIO for Monument Health. We are a not-for-profit healthcare system in Western South Dakota, serving most of the western half of the state, as well as some of eastern Wyoming and northern Nebraska. And I am an internal medicine physician by background, but am spending basically all of my time doing these two jobs I have now.
Awesome. Thank you. Karen.
Yes. Hi, I'm Karen Murphy. I'm the Chief Innovation Officer at Geisinger. Our headquarters are located in Danville, but we have several locations across Pennsylvania. We're an integrated delivery system with we have a health insurance plan along with clinical platform and a medical college.
Yeah, it's a great place to be. Raj?
Thanks, Shahid. Great to be on this panel. So my name's Raj Agarwal. My current role is actually in the private sector. So I'm a Chief Growth and Strategy Officer for an early stage digital health marketplace that's a Vizient member-backed venture. To bring digital health suppliers and health system buyers together and try to do that seamlessly. I think the reason for me being on this panel is that I've spent 20 plus years working in academic medical centers as a clinician, as a scientist, and most recently leading ventures and innovation at the Jefferson Health System in Philadelphia. Great to be here.
Thank you. No, it's excellent backgrounds that each one of you have. So let me start off with the first question. Stephanie, we'll kick it off with you. This idea of hybrid care, what do you think how should we define it? Is the nomenclature of hybrid care useful? What are you seeing as a CIO in a geographically dispersed area? Because not everything is central for you guys. So what do you think about hybrid care? Is it new or about the same as before?
Yeah, I mean, I do think that terminology is helpful, especially when we're trying to establish new norms, because if we can create some terminology that we agree on, even if we decide to discard it later, it at least helps us identify in a conversation that we're all sort of at least talking about the same thing. I think we're seeing something similar when we talk about digital health, right? If you ask somebody to give their definition of it, not always the same. We kind of know it when we see it, but we may not really be able to put it into a succinct sentence. So, when I think of this conversation around hybrid, I think it's really about, hey, we've done things in a variety of different ways. We catapulted some things really far forward really quickly. We're seeing some of them pull back because they didn't fit all the situations. So I don't know if it's as much hybrid as really trying to identify in the various elements of a patient's journey, wherever that might be, what's the right tool set to help that patient be as successful as possible in getting through whatever that situation is, whether it's an illness or promoting health or whatever, but we have a broader tool set than we had before. And we really, it's an opportunity to look at which tool is the right tool and how do we understand what the right tool is and create that as a definition, not something around the idea of because somebody can sell it to me or because one other organization made it work. I think we really are going to have to try and come to an understanding together about what are the barometers of what makes something good in a particular environment versus another. And that I think we also have to realize, just like we've been doing for a long time, it works super well in New York or in Pennsylvania or Texas may not work the same in South Dakota or Utah or Nebraska. And so I think hybrid is really, let's figure out what fits each of us, leveraging the best of what we've seen and how to make that work for our patients and making them successful.
No, I love that. In fact, if you encapsulate what Stephanie just said, Karen, the broader tool set is very important because we definitely have that. But it seems like one other thing that we have now is proof that both physicians and health systems and the care delivery providers and the patients are willing to accommodate and accept this if necessary. So now the question is, Karen, what have you seen, from the Geisinger point of view about where has, and let's just look at it in a very narrow sense of telehealth, remote care, et cetera, where has it been super helpful, super useful in this condensed innovation time versus where has it been less helpful? Because for you guys, this is very different than health systems that are not integrated, where the health systems that have to provide care and then go ask for somebody's reimbursement for it may have operated very differently. But Karen, you and Geisinger have not had to worry about that particular problem. You know that if you ever wanted to do telehealth, you could have done it 5 years ago, you could have done it 5 months ago. Is that different for you? And what do you think about what Stephanie said with respect to the broader tool set and patients' willingness to adopt this hybrid care?
So a couple of, and I agree with everything Stephanie said, I always find it interesting that healthcare approaches most everything differently than other industries. So other industries, we have a phone that we can FaceTime that's been around for about 10 years. And I think when you think of the online retail shopping, when you think they really didn't, they announced it as an improvement in customer service. They didn't announce it like it was a major transformation, right? The expectation just came to be that the companies or the industries were actually leveraging available technology to improve the experience. And I think it's different that if you listen to all of us talk in the industry, we leveraged a technology that's been around forever. And it forced us for more rapid adoption. Now, there's a couple of reasons for that. I think let's take a look at, and we also at Geisinger, while we have our health plan, we also take other payers. So we participate with all public payers, both on a fee-for-service and value-based contracts and other insurers. So, I mean, the real reason why there was low adoption, if we talk about virtual health, was really the reimbursement. The business model did not support the innovation, right? So during the pandemic, that changed, and voila, you see everybody accept the innovation. So I think there's a lesson there in that the business model has to match how fast we want to innovate. And I think we can't discount or we can't talk about digital strategy or virtual care or care transformation that doesn't have a sustainable business model. So I think in moving forward, when we talk about what does healthcare delivery look like, I think we have to obviously take that into consideration. We would go 100% value for every payer tomorrow because it allows you to do exactly what we did during the pandemic. We did the right thing for the patient, for the provider and our employees. And really, when you look at status quo, that really impacted very negatively from a financial standpoint, right? Because you lost your fee for service. We canceled services. We did everything that was right to mitigate the spread of the disease. But at the same time, from a financial standpoint, it really was a very challenging situation. So I think going forward, we have to match the value-based payments so that we can be allowed to accelerate because health systems know what they need to do, right? So we can allow to accelerate. And I think also from a virtual care perspective, we have to figure out really where's the evidence that actually demonstrates that we're lowering total cost of care, we're improving outcomes, and we're not just doing something because we can.
Yeah, no, that's a great point. Yeah. So when you think about this, so if you look, Raj, at what Stephanie mentioned with respect to a broader tool set, patients willing to accept this broader tool set, Karen's talking about business models, and for sure, don't just do it because you can do it, but figure out why. Talk a little bit about the business models. You've spoken before about the idea that there's just south or near about $100 billion worth of revenue being produced by digital health companies these days, but there's north of $1 trillion, $1.5 trillion, $2 trillion that health systems are spending to do their job. Why the gap, and how does one fill that gap of everything that health systems are doing and spending but digital health, which is what we're thinking is the driver, this broader tool set for the transformation. Why is there such a big delta between those, and what are you seeing in the marketplace with respect to taking these digital health companies that might help with the business model problem that Karen is referring to?
Thank you, Shahid. Look, I think there's a lot to unpack here in terms of this. Let me start with one point and then make two others. The first is the concept of hybrid care delivery. I think this is a transitional space that we're in. And if we go back to, let's take banking, right? I remember when I was a kid, my dad took me into a bank and we opened a bank account. And any time that I had some pocket money, I would go to the bank down the village. I grew up in a small English village, and put that money into the bank, right? That was the way that we did it. Travel agents, same thing, right? The last time I went into a bank was actually to open a new account because they needed to see my passport and so forth. But apart from that, it's been over 2 years, right? But we don't call it telebanking. It's just banking, right? So this concept of telehealth, virtual care, I think we're in this transitional period where, even if you go back to you mentioned in the introduction, home care. Well, home births were the norm 30, 40, 50 years ago. And now we're kind of trying to go back to home care, right? Okay. So this is all healthcare, and this kind of hybrid care delivery model, I think, is a transition, and we're going to need to find where is the sweet spot. And as Stephanie says, it's not the same. It's not the same for every service line, every health setting, every individual patient, every provider, right? And there needs to be that ability to be dynamic in this process. Going to your actual question around the business models here. Yeah, you're absolutely right. There's 610 IDNs in this country. There's net patient revenue north of $1.1 trillion, right? These are the health systems. Just where I used to work at Jefferson, a $5 billion net patient revenue system. Karen works at Geisinger and Monument Health, where Stephanie works, and many others. This is where care is being delivered, right? And these are the trusted beacons. And this is even more important in the last 12 months with COVID. These are the trusted sites of care, right? Trusted by community. You see what's happened with providers. In the UK, my home country, people were every Thursday night clapping for the NHS, would get out on their balconies. And, it was the teachers, the healthcare providers, so are respected. And I'm not trying to poo-poo the digital health companies that, as you said, are a much smaller kind of revenue. They're doing a great job. And what they're realizing now is that they can't just be a technology company, right? And so the two things are happening. One is they are partnering up. Let's take One Medical is partnering up with health systems, right? Multiple health systems to kind of say, hey, we can't own all of this. How do we do this to make this kind of seamless approach? But then secondly, you have actually got digital health companies that are now trying to become provider companies. And to me, that's the wrong way around. We are, as health systems, the providers. We are trusted and we own this space. And so we shouldn't let it go for the sake of our providers and our patients, right? And so I'm somewhat dismayed by when you hear about digital health. What's the thing you hear? This amount of funding that's going into healthcare. It's this venture round and this SPAC and so forth. Now, I've said this previously. I get all that, and I get the gross kind of valuations of a lot of these companies. But instead of earnings per share, what about outcomes per share? What are the outcomes that these companies are delivering, right? In terms of our patients, in terms of our providers who are frustrated with the electronic medical records and so forth. And then one final point I just want to make around the business model. I get everything that Karen's saying, but the challenge between kind of consumerism outside of healthcare and healthcare is in healthcare, it's other people's money. No one is paying for their own healthcare directly. And that's the other challenge. It's such a circuitous route around this kind of payment models. And somewhat, sadly, I think part of that's by design as well. So those are kind of the three high level points that I'd like to make, certainly in response to your question.
Oh, perfect. And Stephanie, if you want to comment a little bit on what Raj was mentioning, and that is, as a CIO, you're obviously responsible for a few different things, right? Both as a physician, but certainly as a person who is looking out for these innovations. What are some of the common problems that you're seeing that are being presented to you? And then you just scratch your head and saying, what are these guys thinking of? Why aren't they focusing on this instead of that? And so when you look at this $100 billion worth of net of cumulative revenue that we're talking about that digital health companies are producing, as Raj mentioned, what areas do you wish that they were handling that maybe they're not? And where do you think there's too much? Is there a glut of supply available for certain innovations, but not others?
Yeah, so lots of things come to mind when you ask that question. So I would say, first of all, one of the things I'm seeing is what I see is there's work coming from groups that have been in healthcare, but are now pivoting and expanding. We have a vendor that we work with very closely that has done a bunch of work in other industries that I think they're just now feeling bold enough and the relevance enough to say, well, we've been doing this with the airlines and the banks and whatever for the last 20 years. Maybe you guys want to take a look at it. Mm-hmm. And we're actually saying, yes, we do. And that's been great because they get us. And I think both to Karen's point and Raj's point, we're similar, but we're different. And there are pieces so one of the challenges that I see is on the spectrum of those that are newly entering the space. I feel a lot of sort of overpromise and underdeliver risk. I really am not. I mean, if you come to me and tell me give us, 2 days and some of your team's time, and by next week, you won't have to deal with any of the challenges around distributing vaccine. They'll be fixed. We can do this by next week. I'm like, really? I mean, really, can you? You're going to deal with the phone calls that are going to come in. You're going to deal with the screening. You're going to take that screening and turn it into an appointment. You're going to send, and then you dig in a little deeper and it's like, well, no, we're not going to do that part, but we can automate the phone calls. So at least you don't have 20,000 people calling you at once. Well, then just tell me that, right? I don't want to hear that, within 1 week, we can go from my whole team and operational teams across the health system being completely overwhelmed to, sitting around with nothing to do, and then have a little deeper conversation and say, well, that level of integration isn't really something we've actually done, but boy, we could really help with, these pieces. So I think they're targeting the right things. I hear a lot of pieces areas coming in. I think automation of simple tasks is a great place to focus for healthcare. Again, given the trusted relationships that we have, I don't see us going to digital solutions that sort of replaces that more intimate and personal relationship when it's really needed out of the gate, right? Let's automate the easier and the less intimate stuff, like some of the billing side, the revenue cycle, even some of the patient-facing things like, phone calls and or using IVR and some of these other things to take what is a heavy demand and maybe not enough supply and distribute and make people a little more open to it. But again, when the retail companies started rolling out their framework for online shopping, I still went to the store most of the time initially. And I shopped online for the stuff. I was like, well, I already know what size I wear in this and I need another pair. I'll go ahead and buy it online because I don't need to go to the store, right? We evolved in this together, and I see healthcare doing that too. And so I'd like to see them let's start with some of the easy stuff. Let's knock some stuff off that's low hanging and low risk, but taking up a lot of resources. And to do that, you need to understand my business a little bit better. And so don't oversimplify it and don't overpromise something. I'll take something that's simple, but does something really great and does it really well.
Yeah, that's a great way of putting it. And Karen, so Stephanie is much nicer than I am. She's saying overpromise, underdeliver. I would just say, don't bullshit me, right? If what you can do is just the easy stuff, say it's the easy stuff and you still have to do the hard stuff, right? That's truly what they're saying is, all the crap that you think, so digital health companies, and as an angel investor in the field many times, what we want from the hospital end is do the hard stuff for me. But if you can't, tell me what easy stuff you're taking off so I can still put the right people on the right jobs to do the hard stuff. Unfortunately, very few, and Rajesh, after Karen provides some comments here, I'd love for you to talk about who are the companies out there that are doing really the hard stuff rather than the easy stuff. But Karen, I'd love for you to kind of like piggyback on what Stephanie said and say, are you guys, as from the innovation angle, being BS'd a lot, and you can now see through the BS? Or is there a lot of fluff and there's a lot of supply going on for this hybrid care model that we're trying to move to? And there's still lots of weaving and bobbing and stuff that you guys have to do on the buyer side to figure out where can you apply some of these technologies coming in? So are you being BS'd a lot? Number one, kind of like what Stephanie was mentioning. And if so, what would you recommend the innovators do to really clarify the evidence that you asked for? I think that's like super. It's like, what are you looking for in terms of evidence that would cut through all the BS so that we can move through a better buyer innovator procurement type of discussion?
So I think, as Stephanie said, there are so many companies, and I think the number one worry that I have leading a digital strategy is, are we siloed to the point where we have so many one-offs, So we have this company who does IVR for the call center. We have this company that does IVR for appointments. We have this company that perhaps is doing it for another use case that we have. So I worry that we'll create this digital nightmare, that it will be analogous to as at the advent of EHRs, we thought were so wonderful. And really what we ended up doing was creating electronic filing cabinets. So unless you're within the healthcare system, you know, your record isn't unless you voluntarily get that record and allow another provider, it's not like all the providers in the world can look at Stephanie's record or Raj's record or my record. So I worry we're doing the same thing with digital strategy. So we're getting a solution for a diabetic. We're getting a solution for somebody with congestive heart failure, when really we should be looking at the patient much more holistically. They are not just a diabetic. They have hypertension. They have, well, we don't want to do digital strategies for all those diseases, right? So we want to look more holistically. And I think this is relatively new to the industry. And when you think about the startup industry, is also, as Raj talked about before, when you talk about the booming startup industry, I mean, 10 years ago, you wouldn't even have that available to you to have all these solutions. So I think we really have to be selective when we, when we're talking to these companies. And I think the other part is sometimes we don't know exactly, we don't articulate well exactly what we're trying to solve for. So if we can't articulate the problem, I highly think they're not going to be able to answer the question, because we're not articulating what we're trying to do. And mainly it's due to the inherent complexity of the delivery system. So, I think there's enough to go around that we have to get better at what we do, to be focused as to what our needs are and to be able to well articulate what we're trying to solve for and how we're going to measure it. And I think we have to learn, again, solve for a problem, not chase the shiny new nickel. Don't get that app just because you can. Get it because you can articulate what it's going to solve for.
Yeah, great point. So Rajesh, we're going to open up the question to the audience just in a few minutes, and we'll let you take us home here into the Q&A. So two things I'd love for you to talk about is, one is piggybacking on what Karen just mentioned about how do you establish expectations. You're 20 plus years in innovation at Jefferson. What ways did you say, look, if we articulate our expectations better, then maybe the innovators can give us the outcomes better and get to better outcomes per share, as you were mentioning. So that's one area. How do we set expectations? And it's a second area, the Silicon Valley style of MVPs and starting quick and deliver something that somebody can use tomorrow morning. That to me seems like old and tired, and you got to give something of high value. And in healthcare, unless it's got end-to-end capabilities and end-to-end integration friendliness, it can't possibly be useful. So just love for you to talk about those two subjects: is how do you set expectations, and how can we expect startups to do the hard things that hospitals have to solve rather than all the easy stuff?
Yep, no, great questions. And I love kind of taking the lead from what Karen just said. So let me just give you a real life example. When I was at Jefferson leading ventures, we had a bunch of companies coming in. And one of these companies was a digital platform for women with gestational diabetes. And, they've done a great amount of research, actually published peer-reviewed research where they showed that the outcomes for the mothers and for the newborns was significantly better, lower in C-section rates and large for dates babies and all that kind of stuff. I said, I really want to bring this in. It was a UK company. We're going to invest in them and so forth. And the approach that we take is, we don't say, I think Karen said, the bright, shiny object, here you go, use it. What we do is, and you might call it a design approach or so forth. But the first thing we do is, let's map out what your current state looks like. What does just today look like, from diagnosis of gestational diabetes through to everything that woman has to go through, all the providers? Let's map it all out. And I did this with a couple of the providers, and it was a big, long, whiteboard. We had a white wall, all of the different things, right? And then Let's ask these providers, close your eyes and imagine, what does ideal look like, right? And that's on the top of the board, right? This is what it should look like. And then what are the metrics of interest on that y-axis to take you from current state to ideal state, right? So, is it number of times that patient needs to be seen in the office? Is it number of admissions? Is it, number of times their blood sugar is too high, too low, a large for dates baby that needs a forceps delivery or something like that. And on that basis, then what we would do is say, well, where is the biggest delta? Where's the biggest opportunity between current state and ideal state? Where's the area to fight, right? Okay, so that's the mapping exercise. And then I would bring in, here's this technology. What do you think about it? And where does it fit on this map, right? And that really gives a great construct of how do we make these fit for purpose and not, as Karen says, the digital nightmare, or as one of my other colleagues in Morrison says, that we don't have this pimp my ride approach to healthcare, where we'll just stick something else on and something else on and something else on, and suddenly the car falls flat because it can't take any more weight. That's what we're doing to healthcare with all these point solutions. So how do we approach this from whether that's a service line approach, whether that's an ambulatory care approach, whether that's a complex care monitoring approach. And that's really what we have to do. And again, I'll go back to what I said, we as health systems need to own this space. So we need to guide and direct the digital health suppliers to say, look, Livongo, you got to work with this digital health company that does this, and you got to work with this company. I mean, they're starting to do it themselves, Livongo, Teladoc, and InTouch, right? But we need to be able to own that and say, this is what works for my health system, right? So that's the first piece. The second piece, I think, is a critical question, and it, about the MVP, break things, and so forth. Look, that's still fit for purpose to try things out, and we've all been at hackathons and seen those. Those are nice, what we call innovation theater, innovation showcase. There's not an intent to go anywhere, but it's about getting people engaged and excited about innovation in healthcare. Great, right? It's a great kind of academic approach. But in terms of actually caring for patients, this reminds me of David Blumenthal, the head of the Commonwealth Fund, and he wrote an article, I think it was New England, maybe over 10 years ago, about the dual eligibles, right? The Medicare, Medicaid patients who cost 80% of care or end-of-life care and so forth. And those are the really, really hard patients to take care of. But if you can take care of them, there's a huge opportunity to improve their quality of care because they have 3 to 4 chronic diseases, right? And they have all the social and the economic issues, right? So how do we support them? So companies such as CityBlock Health that's really gone out there and said, yes, this is the group of patients that we're going to go and serve. And look, they're making revenue, right? It might not be as much as some of the other shiny object companies, but I'll tell you, the work that, the little that I know about the work that CityBlock Health is doing, I think they're going to be around for a lot longer because they have now created this commitment to this group of patients that, quite frankly, no one else cared about, right?
No, I love that. In fact, Roger, exactly right. And that was a perfect example that takes us into our Q&A period. So during the Q&A, let's ask some hard questions about who are those companies that are going to really bring this hybrid care in a way that the health systems can truly partner with, own it, and take it forward. So with that, I'm going to thank Stephanie, Raj, and Karen for their prepared remarks. And now we're going to take it into our Q&A. So I thought maybe we'd start with one question that has come up over the last couple of days in multiple sessions has been strategic mistakes maybe, or things that people aren't thinking about when they're setting up their strategy for the go forward, whether it's purely digital health or more beyond that in full digital transformation spaces. Who wants to jump in first to be open and honest about what maybe some of the biggest mistakes that we might be making as a health system? And you don't have to use your examples directly in case that gets you in trouble, but what you might be seeing in the industry as mistakes. Anybody want to jump in first? Stephanie, Karen, or Raj?
I'll go, Shahid. I think we said it during the panel around just having too many point solutions or too many non-joined up solutions. And we've really got to think about digital health innovation around the paradigm of the patient care, the clinical care pathways, but also in terms of the providers that need to be able to deliver that care, right? So I think I don't have a specific example, but certainly I think there's too much of little stuff happening. And I gave that kind of example, trying to go for the low hanging fruit. We'll do a bit here, we'll do it. Well, that's not going to make the tree bloom if you just go for the low hanging fruit. And I think another approach here is there probably aren't going to be just, these are the 5 solutions that are going to fix all this. We as health systems are going to have to work together and actually coach the various companies to say, you got to work together to have these kind of, I don't like the word bundling, but that's probably the only word I can think of right now, to put these solutions together so then they fit for whether it's a service line or ambulatory growth area, and really align with the clinical care pathway.
So Stephanie and Karen, you're welcome to add on to that, or maybe answer a slightly different question, which is, how could you make it worth the while of innovators that would be able to see into your strategy and say, you know what, instead of me coming by myself to your health systems, I will team like Raj is suggesting. How do we make it worth the while of the suppliers and innovators to do that?
I think it is about collaboration, really, right? I mean, it's coming together, whether it's multiple health systems coming together and then working with some of our vendor partners to sort of say, right, because that could make it worth the while. I maybe as one health system can't give enough or be, I'm not going to be a financial partner or customer that's large enough to sort of help them be able to take the leap. But if I can come together with 4 other health systems and we can all kind of agree on some commonality, that probably means 2 things. One, there's at least 4 customers who are able to do this and we can do it together. And it means that there's a little more backing to sort of give them the confidence that they need, that it's worth the investment. That would probably be the place I would start.
Yeah, that's a great idea. And Karen, how much are you able to at Geisinger look at strategy with certain solutions, not necessarily specific vendors, but knowing that technology A, B, and C are out there, and that's how you should set up your strategy? Or do you guys set your strategy and say, look, I'm not worried about what solutions are out there. My strategy is my strategy, and then we'll figure out what solutions to get. What's your approach to setting up strategy?
I would say it's the latter. First of all, identifying what the problem we're trying to solve. Mm-hmm. And then I think to your question of what are the biggest mistakes, I think what I see is the rush to digital. Mm-hmm. We don't want to take the time to apply design theory. And really, if you don't do that, what you end up doing is digitalizing today's operation. It's not really transformative.
Right.
And at the end of the day, I think we'll fail if we continue down that path. So we try to put a lot of time, and I'll tell you, even for business owners who are so excited to get into this space. We really have to push back and say we have to do the design process that answers all the questions, maps out the patient journey, and we understand how this strategy fits in with the larger strategy.
Mm-hmm. And at Geisinger, I wouldn't be worried that the design strategy was a way of pushing off the decisions and actually doing something. But you could see where that might be a mistake.
Yeah.
If you just keep thinking and don't actually go to implement something, no amount of design theory is going to help you. How do you find that balance? You got to do something, but not before you think about it.
Yeah, I think that's true. And I think, we're solving for problems. So everybody wants to get their problems solved pretty quickly, right? So when you say it's going to be 4 months before we get there, you're not met with a lot of cheer, right? So I think really educating on the process, but I do think as innovators, we have to find the balance of, to your point, not taking too long, because we just lived through a year that we innovated within hours, days, not weeks or months. Mm-hmm. So we have to find the balance to be able to do an adequate job and achieve a good outcome in a reasonable amount of time. And really, to your point, not delay. I mean, we can't do that. So it's a balancing. I believe it's a balancing act.
Yeah, and Stephanie, you were nodding when Karen was talking about strategy. So do you guys also choose the latter, which is not really look at solutions and what might be available to map a strategy, but do it independent of what solutions might be available, or some mixture?
Well, I think it depends who you might ask in my organization. I think as a leader on the technology side, this is a mantra that we really try to continue to hammer home is start with a problem and find a solution instead of finding a solution to apply to a problem that you may or may not identify. The reality is, I think to some of Karen's point, as always, it's a little easier to go to the shiny cool thing than it is to really dig deep and sort of say what's fundamentally broken here. And I think that some of that has been demonstrated in this last year, where we did innovate quickly and we got stuff out there, but look how much of it we've rolled back, right? At least in parts and pieces, because we couldn't do the design that we really wanted to do. We couldn't do some of the pieces we had. It came out of necessity and it catapulted us forward, but some of it wasn't sustainable. And so it's really understanding what's right, because the pendulum, it's been this heavy swing back and forth, and it's really going, okay, let's slow that pendulum down and meet in the middle somewhere. And so I think it does have to start with strategy. I think one of the things that we can do as health systems is, and it's hard, we aren't always sure we want to share all of the things that are happening with us, but invite, in the same way that I will tell operations, bring me the problem and let my team come in and listen and take our expertise and try and figure out what we can bring to that problem. I think we have opportunity with some of our vendor partners to do the same and be willing to invite them in a little bit closer, not like a conference room when we're doing that again or whatever, and sort of saying, well, hey, sit across the table and have a conversation, but like, let's walk through the halls of our hospital. Let's walk through the halls of the clinic. Let's walk through the workflow of what a remote monitoring, patient journey looks like, and really invite them in with their expertise to help us solve the problem. I think we are at times reluctant to do that. And for, in some cases, good reason, but I think we'll all get further faster if we partner in those ways. Oh,
I love that idea. And Raj, especially given your new role outside of Jefferson now at Panda, you've got about 90 seconds. So I'd love for you to kind of, synthesize what Stephanie was saying. How could you pull that off with all these suppliers that are clamoring to get into the hospital and go do something? What's a reasonable way to pull it off?
Look, I love what both Stephanie and Karen said, and taking what Karen said in terms of it's not just turning the technology on. There's the people, the process, integrating into the workflow. We're not starting at base level. There is already, these health systems deliver care already, and we're trying to integrate that digital technology into that. That's the number one piece, right? And the second piece that Stephanie said that I absolutely love is the power of collaboration, the power of many. And as we think about that in healthcare, we think about that as a cost reduction. It's like group purchasing. That's what we do, right? But here in digital health, from an innovation perspective, the suppliers want to know what's the best way to get their solutions into the health systems, but then even more importantly, what's the value that they're creating? And no one health system, unless it's we have about 3 very large health systems in this country, but apart from those 3, the others are not able to do that. So imagine bringing together a Jefferson, a Geisinger, and a Monument Health and saying, look, and others together saying, these are the desired needs, whether it's remote monitoring, AI chatbots, scheduling solutions. We're going to bring them. Yes, there'll be a price reduction because there's group purchasing. But then we're going to work together to make them fit for purpose for people, process, workflow. And then we're going to measure the clinical, operational, and financial metrics of success. And that really is a win-win approach on both sides of the table, just as you were saying, Stephanie, for the health systems to come together. And guess who wins at the end? It's our patients and providers.
Yeah, that is awesome. That's a great way to synthesize this. And thank you all for participating here. You got some great advice, Stephanie, Rajesh, and Karen. And hopefully the rest of you will. So we're finishing up here. We're going to join the ending keynote with Dr. Lena Wen talking about of all crazy things, vaccines and pandemic. So please join us there, and we'll close out over there. Thank you very much. Bye.
Thank you.
Thank you.